In this video, we're going to talk about major depressive disorder. Depression is much worse than simple unhappiness. Major depression, also known as clinical depression, is a complex mood disorder caused by various factors, including genetic predisposition, personality, stress, and brain chemistry. This means that a person's emotional state is abnormally low or sad, and the person cannot independently raise his or her mood.
Overview, background and significance, nursing care and evidence-informed practice, summary, implication and conclusion.
Canadian statistics on MDD or major depressive disorder says that 1 in 5 Canadians experiences a mental illness in any given year. When Canadians reaches 40 years of age, 1 in 2 have or have had a mental illness. And about 11% of men and 16% of women in Canada will experience major depression in their lives. The prevalence of major depressive disorder or MDD in 2012 was 3.9 higher in women in younger age group between 18 to 24 years old. 15.2% of Canadians experienced MDD in the fall of 2020 during the second wave of COVID-19. The effects of depression are many, including limiting your quality of life, affecting relationships, causing lost time at work and school, contributing to other chronic conditions like diabetes and heart disease, and sometimes even leading to suicide. Fortunately, most people can be treated effectively for depression. In the past 2 years, COVID-19 pandemic affected in the increase in cases of depression among Canadians. Epidemiology and Demographics. In 2012, approximately 11% of Canadians meet the criteria for major depressive disorder at some point of their lives. The suicide rate among people with depression is approximately 2% in 2012, and half of those who committed suicide have been in contact with their general practitioner in the month prior to their death. The peak annual prevalence was found in the group aged 15 to 25 years old. According to a 2013 study, 3.3% of 34,039 post-secondary students self-identify themselves as indigenous, and they are most likely to get diagnosed with depression than non-indigenous students. The epidemiology of major depressive disorder, or MDD, was first described in the Canadian population in 2002. The latest data come from the Canadian Community Health Study, Mental Health, in 2012. National College of Health Assessment, American College Health Association Spring 2013 survey, 34,039 participants in 32 post-secondary institutions across Canada. The study aimed to estimate the widespread of mental illness and substance use among Indigenous students attending Canadian post-secondary institutions.
The sign and symptom for depression: insomnia, hyperinsomnia, reduced interest and loss of pleasure, guilt, mental and physical fatigue, concentration difficulties, memory disturbance, appetite decrease or increase, psychomotor retortions, agitation, suicide thoughts, plans, and behavior. Depression is commonly occur in age 15 to 45. Depression, especially in midlife and older adult, is because of serious illness such as diabetes, cancer, heart disease, and Parkinson's disease.
For social determinants of health, it includes income and social status, employment and working conditions, genetic or family history of depression, education and literacy, psychological or emotional vulnerability to depression, major stress in the person's life, age, gender, marital status, education, and income. Genetic and family history of depression does not necessarily mean that the children or other relatives will develop major depression. However, people with a family history of depression have a slightly higher chance of becoming depressed at some stage in their lives. There are several theories to explain this phenomenon, but we are not going to talk about that right now. Psychological vulnerability. A personality style and the way you have learned to deal with problems may contribute to the onset of depression. Life events or environmental stresses, Some studies suggest that early childhood trauma and losses such as the death or separation of parents, or adult life, even such as the death of a loved one, divorce, the loss of a job, retirement, serious financial problems, or family conflict can lead to the onset of depression. Biological factors. Depression may appear after unusual psychological changes such as childbirth and viral or other infections. This has given rise to the theory that hormonal or chemical imbalance in the brain may cause depression.
The DSM-5 outlines the A nurse assesses a client.
Treatment for the depression. Not
Nursing assessments. The detailed associated and mental health is just.
Most patients that nurses find.
And lastly, conclusion.